My daily duties as a head nurse here in Detroit entail making sure that policies are appropriate for treatment on the floor, staffing schedules are appropriate and well organized, making sure that the soldiers that work underneath me have what they need to do their jobs appropriately and effectively for the patients. I also work within the TCF structure on the daily operations of the facility. Care for the patients is very similar to that of the hospital. We just don't have the four walls. There are meals provided and catered in through our dietary services. We have physical therapy and occupational therapy that come in and work with them to help transition them out to either home or nursing homes, as the case may be. We also do our medications with our pharmacy to make sure they get their daily medications for chronic illnesses such as COPD or heart conditions. We try to take care of them as close as we can to what they would receive in any other hospital facility. Part of what we look for a patient to be discharged or transferred out is how close are they to their true baseline prior to having the COVID-19 illness. What were their oxygen needs if they do have chronic oxygen? What were their physical capabilities beforehand? Are they able to take care of themselves if we are sending them home? Or are they able to find family members to help care for them during the final stages of their healing process of the illness? The final decision to discharge or transfer a patient is a combination of the physicians caring for the patient on the floor and a close review of the patient's overall case before they get discharged or transferred out. Want to make sure that when they do transfer out back to home, that they have a very good success rate at home and recovery. Our differences between our normal 801st cash and here is that on the 801st cash, we do a lot of training focused on combat-related injuries. Once we arrived in Detroit, knowing we were coming in for COVID-19 recovery, this is more of an illness that we have never seen before. It is an illness we've never trained on before, and it's an illness that not many in our unit, up until a few weeks before deployment, had really had much hands-on experience with. On the public health side, they have brought an exceptional team with them that have been team players. They've been communicating well. They've helped us integrate when we first got here, and they've helped make sure that we've integrated throughout to help for a successful mission and patient care outcomes. One of the more gratifying aspects for this has been the soldiers we brought. For years we've been training. Not many have been deployed or had any secondary missions to go on to exercise what they've learned. Now we've been able to bring it all together and see that our training is truly paying off, that we are able to function as a team, we are able to take an unknown mission and make it appropriate, make it successful as a group and as a whole. I'm Derrick Williams, Lieutenant Colonel of the United States Army, serving here in Detroit, Michigan.